the healthcare landscape is very challenging right now. Jeff, where do you see the healthcare landscape kind of going? And I'll ask the same question to Eric. How do we support people across all of healthcare to start to work in a space that you just described, Eric? How can we do that? Do we need to do that?
As Eric pointed out, it improves the patient experience, and it seems these days reimbursements are becoming more and more tied to patient experience or satisfaction. So in the long run, hopefully this approach is going to pay financial dividends on top of the meaningful value dividends of a better experience for our patients. And furthermore, if we provide a good experience for our team members, lower attrition, lower turnover. And furthermore, once we have a great experience for our patients and a great experience for our teams, there's a higher buy-in from the patients. So I'll use the word compliance, but there's a high risk of patients not following instructions because they're not really bought in. And if they become bought in, and they're more likely to follow instructions and be co-creators of their outcomes, hopefully lower complication rates and better outcomes, which might in the long run lead to lower repeat unnecessary visits had things gone the way we wanted to go in the first place. So from a societal or system perspective, even though it may take a little extra time on the front end, I think it saves time on the back end.
Yeah, definitely. Yeah. Eric, do all of the administrators, the service line directors agree with this approach and this way of creating the experience at your facility? Do they all do that, or is there some back and forth?
Well, I think everyone fundamentally agrees, but everyone gets challenged in their own workspace. So it's sometimes easy to lose sight of the goal when you have a little attrition, unexpected leave, some other pressures come into play. It's sometimes you can easily get lost along the way, I think. And we have a directors group at the hospital that gets together on a monthly basis. So one of the great things is we try to support each other through that process. When a particular service line or service line director is having a tough bumpy go because of some change or attrition or that type of thing, we try to support each other through that, because we've all been there, we'll all be there, in that process and whatnot. And the camaraderie, I think, amongst what I call like us middle managers, right? I feel like I'm the middle of the Oreo cookie sometimes, right? I have the senior administration up here, right? And sometimes senior administration, it is, you're trying to meet the metrics, right? And meet the productivity and the budget and all those things. And then the bottom part of your Oreo cookie is your teams, right? And your staff, and you're in between